Margaret was 67 years old, retired schoolteacher, walked 2 miles every morning before breakfast, took her blood pressure medication without skipping a single dose, watched her salt. Quit smoking 11 years ago. Her last checkup, 6 months before, her doctor looked at her chart and said, "Margaret, whatever you're doing, keep doing it." She walked out of that office feeling like she'd won something. She died of a massive heart attack at 11:40 at night. Not during the walk, not during exercise, not during any moment of visible stress. She was in bed. She had just finished the same routine she'd followed for 30 years. A small glass of warm water. The news on low volume. The ceiling fan on the second speed. Everything the same as every other night. And somewhere between turning off the lamp and falling asleep, her heart stopped working. Here's what nobody told her. Not her cardiologist, not her internist, not the pamphlet they gave her after her last EKG. The hours between 9 o'clock at night and 2 in the morning are not neutral time for a heart that has been carrying a human body for 6 decades. They are the most dangerous hours of the day. And the habits most people consider harmless, the small rituals of winding down, the patterns that feel like self-care, some of them are quietly stacking the odds against you while you think you are resting. Today, every single thing on this list is something you can change, starting tonight. Stay with me. My name is Dr. Raymond Caldwell. I am a cardiothoracic surgeon with 31 years in the operating room. I have performed over 2,000 open heart procedures. I have held beating hearts in my hands, felt them labor, felt them hesitate, felt them stop. And I have spent 3 decades watching the same devastating pattern repeat itself in my patients. People who did everything their doctors told them. People who were careful, who were disciplined, who genuinely believed they were protected. And then they arrived on my table, and we opened their chest, and what we found inside told a completely different story than the one their last checkup had suggested. I am not here to frighten you. I am here because the system, the 15-minute appointment, the prescription pad, the discharge summary nobody reads, does not have time to explain what I am about to explain. Doctors mean well. I know because I am one. But meaning well and having time to tell you everything are 2 entirely different things. What I give you today is what I give people after I have cut through their sternum, repaired what was failing, and am standing in the recovery room trying to make sure they never come back. Here's what nobody tells you. The heart does not observe a rest period at night. It adapts, it shifts. And in a body over the age of 60, those nighttime shifts carry risks that simply do not exist in younger physiology. Think of it this way. When you were 35, your body had what I call margin. It could absorb disruption. One bad night, one spike in blood pressure, one extra strain, and the reserve capacity was there to compensate, to buffer, to correct. After 60, that margin begins to contract, not disappear, contract. Your arteries have experienced decades of pressure. Their walls have stiffened. The elasticity that once allowed them to flex and absorb is diminished. The electrical system that coordinates your heartbeat has accumulated small inefficiencies. The autonomic nervous system, the one that controls your heart rate while you sleep, while you breathe, while you dream, responds more slowly and less precisely than it once did. The result is a cardiovascular system that is still capable of extraordinary function, but has lost its tolerance for disruption. Studies show that more than 60% of fatal cardiac events in adults over 65 occur between the hours of 6 in the evening and 6 in the morning. Not during exertion, during the hours when most people believe their heart is finally getting a break. It is not getting a break. It is navigating a different kind of stress. And some of what you are doing right before you close your eyes is making that navigation significantly more dangerous. Write that down. Here is the first thing you need to stop doing before bed. And this one is going to surprise you. Number 1, eating within 2 hours of sleep, even a small amount. Most people think the danger with late eating is weight gain. That is the version of this conversation that made it into mainstream health advice 20 years ago and never left. Here's the version that doesn't make it into the pamphlet. When you eat, even a light snack, even a handful of crackers, even a piece of fruit, your digestive system activates. Blood is redirected away from your extremities and toward your gastrointestinal tract. Your heart must now increase its output to support both the resting state your body is preparing for and the active digestive demand your stomach is generating. In a younger body, this dual demand is handled without incident. In a body over 60, where arterial stiffness has already reduced the efficiency of blood distribution, this redirection can create a measurable drop in blood flow to the coronary arteries. There is a specific window, typically between 40 and 90 minutes after eating, when blood pressure fluctuates as digestion peaks. In seniors, this fluctuation can be dramatic enough to trigger what cardiologists call nocturnal blood pressure dipping reversal. What that means in plain language is that, instead of your blood pressure falling naturally as you fall asleep, which is the protective pattern that healthy cardiovascular systems follow, it rises. or it dips too severely and then overcorrects. Both of these patterns place direct mechanical stress on vessel walls that are already less resilient than they were 2 decades ago. I remember a patient named Gerald, 69 years old, retired marine engineer. Every single night, he had a small bowl of cereal before bed. He called it his wind-down ritual. Nothing heavy, 2% milk, bran flakes. He had done it for 20 years. When he arrived in my care, the pattern we found on his overnight blood pressure monitoring told a very specific story. His pressure was spiking at approximately 11:15 every night, almost exactly 90 minutes after his nightly bowl of cereal, and it was staying elevated until past 2 in the morning. Imagine your heart having to push blood through stiffening arteries with elevated pressure for 3 consecutive hours every single night. Do that for a decade. Then ask why Gerald's heart showed the damage it showed. Stop eating at least 2 hours before bed. If hunger is genuinely disruptive to your sleep, a tablespoon of almond butter is the one exception. Fat digests slowly, does not spike blood sugar, and does not trigger the same digestive blood redistribution that carbohydrates do. That is your specific fix. Have you been eating late at night without realizing the pressure it puts on your sleeping heart? Tell me in the comments. I read every single one. Number 2, sleeping flat on your back without elevation. Before you click away thinking you've heard this before, stay with me. Because what most people have been told about sleep position and heart health is incomplete. Yes, sleeping on your left side reduces pressure on the vena cava. Yes, elevating the head of your bed has benefits for acid reflux. But here is the specific cardiac mechanism that nobody explains in the context of senior health. When you sleep completely flat on your back, the weight of the fluid in your body redistributes. Fluid that was sitting in your lower legs during the day. Fluid that accumulated there because of the combined forces of gravity and any degree of venous insufficiency that naturally develops with age. That fluid migrates upward toward your chest and your heart during the night. This is called nocturnal fluid redistribution. And in seniors, particularly those with any early-stage heart weakness, even a subclinical degree that hasn't shown up on an echocardiogram yet, this fluid increase in the chest cavity raises the work your heart must do during the very hours it was supposed to be resting. Your heart is essentially receiving more volume to pump at the moment when its own regenerative processes are most active. The electrical system that controls rhythm is simultaneously managing increased volume demand and trying to complete the maintenance cycles that only occur during deep sleep. The result, in a significant portion of seniors, is nocturnal arrhythmia, irregular heartbeat events that occur during sleep, that the person never feels, that never show up in a resting EKG taken at a morning appointment, but that represent real electrical stress on a heart that is already operating with reduced reserve. The fix is specific. Elevate the head of your bed by 4 to 6 inches, not with extra pillows, which tilt your neck and reduce the benefit, but by placing risers under the legs of your bed frame at the head. This single structural change reduces nocturnal fluid migration measurably. If you have any swelling in your ankles or lower legs by late afternoon, this is not optional. This is urgent. Speak to your physician about compression stockings worn during the day as a complementary measure. Now I need to pause here before we go to number 3. Because what I am about to share next is the item that, in my clinical experience, most directly preceded the events I saw in my operating room. And I want you to understand why it is more dangerous than the first 2 combined when it is combined with either of them. Are you still with me? Good. Let's continue. Number 3. Watching emotionally activating content before sleep. Write that down. This one will change how you spend the last 45 minutes of your evening. Your nervous system does not distinguish between real threat and perceived threat. When you watch the news, conflict, crime, economic fear, political confrontation, your hypothalamus responds to the emotional content as if the threat is physically present. Cortisol is released, adrenaline follows, your heart rate increases, your blood vessels constrict slightly. Your blood pressure rises. This is a physiological cascade, not a psychological interpretation. It happens whether you are consciously frightened or not. It happens even when you feel you are simply staying informed. In a person under 50 with flexible arteries and a robust autonomic system, this cascade resolves quickly. The body exits the stress response within minutes of the triggering content ending. In a senior with stiffened arteries, reduced autonomic flexibility, and any degree of existing cardiac load, the resolution is slower. The blood pressure elevation persists, the mild vasoconstriction persists, and then you turn off the television and attempt to sleep, with your cardiovascular system still in a partially activated state, and your body attempts to perform its overnight recovery processes on top of a foundation that is not yet settled. This is one of the mechanisms behind what researchers call the evening cortisol spike pattern in older adults. And it is not limited to the news. Dramatic television, true crime, thriller programs, anything that generates suspense or moral outrage, all of it activates the same pathway. The specific danger window is the 45 minutes immediately before you attempt to sleep. Content consumed during this window has the highest likelihood of still being physiologically active when you close your eyes. The specific fix is a deliberate transition ritual. 45 minutes before your intended sleep time, switch to content that is visually slow and emotionally neutral. Nature documentaries, cooking programs, anything without stakes, without conflict, without confrontation. The goal is not entertainment. The goal is nervous system deceleration. Your heart will follow. Number 4, taking certain common medications without checking the timing. I want to be careful here because I am not telling you to stop taking any medication. I am telling you to have a conversation with your prescribing physician about when you take it. This is not the same thing. Please hear the difference. Many seniors are on one or more of the following categories: diuretics for blood pressure or fluid retention, calcium channel blockers, beta blockers, aspirin therapy, or statins. The vast majority of prescribing instructions say once daily without specifying a time of day. What your doctor may not have explained, because the appointment was 15 minutes and the prescription was written in the last 3, is that timing matters significantly for some of these medications in relation to your natural overnight blood pressure patterns. Diuretics, for example, taken too late in the day, create 2 problems that intersect dangerously at night. First, they increase nighttime urination, which interrupts the deep sleep stages during which cardiac repair occurs. Second, they can cause mild dehydration by the early morning hours, and dehydration thickens the blood slightly, increasing the effort the heart must make to circulate it during the hours when your blood pressure is naturally at its lowest. In a stiffened cardiovascular system, that combination, thicker blood, lower pressure, incomplete rest, creates exactly the conditions in which the heart is most vulnerable to the kind of electrical disruptions that precede events. Aspirin therapy has a specific timing consideration. Research in the last decade has suggested that aspirin taken in the evening, rather than the morning, may provide better platelet suppression during the overnight hours, the hours during which clot-forming risk is naturally higher. This is a conversation worth having, not a unilateral change, a conversation. Ask your doctor specifically, given my age and my current medications, at what time of day should I take each one, and why? If your doctor does not have a specific answer, that is worth exploring further with a pharmacist who specializes in geriatric medication management. That question has stayed with me from a patient named Helen, 72 years old, who had been taking her diuretic at 9 in the morning for 6 years. One conversation with her pharmacist moved her dose to 7 in the morning. Her nighttime awakenings dropped from 4 per night to 1. Her energy the following morning changed noticeably within 2 weeks. Her heart had been interrupted 4 times every night for 6 years. Sometimes the most significant interventions are the smallest adjustments in the most overlooked details. Number 5, ignoring the signals your body gives you in the hour before sleep. Here is what nobody tells you about the early warning signs of cardiovascular stress and why seniors in particular miss them. The classic image of a heart attack, the dramatic chest clutching, the radiating arm pain, the collapse, is a real presentation. It is also not the most common presentation in adults over 60, and particularly not in women. In seniors, the precursor signals are quieter. They are easy to dismiss because they do not feel like heart symptoms. A vague sense of fatigue that is different from normal tiredness. Heavier, more oppressive, arriving suddenly rather than building through the day. Mild nausea in the evening that does not trace back to anything you ate. A feeling of pressure or fullness in the upper chest that you assume is indigestion. Unusual shortness of breath when you transition from sitting to standing before bed. Jaw discomfort that feels like dental pain, but your dentist has found nothing. Lightheadedness, when you first lie down that resolves in a minute, and so you forget about it. Any one of these, occurring regularly in the evening hours, deserves attention, not panic. Attention. Because the hour before sleep is when many cardiac events in seniors begin, not with the dramatic presentation, but with a quiet progression of signals that build slowly enough to be rationalized away. The specific action is this. Keep a small notebook beside your bed. Every night for 2 weeks, write down how you feel in the hour before sleep. Any unusual sensation, however minor, however quickly it resolved. At your next appointment, show your doctor that notebook, not a verbal summary, the actual written record. What you think is too minor to mention in conversation takes on a different character when your physician sees it listed across 14 consecutive evenings. Your body has been communicating with you for 60, 70 years. It knows how to send a signal. The question is whether you have built a system for receiving it. It is never too late to build that system. Starting tonight. I need to tell you something I do not always say out loud. I have stood in the recovery room at 2 in the morning more times than I can count. I have walked down the corridor to a waiting room where a family is sitting in chairs that no one should have to sit in, the particular posture of people who are waiting to hear news that will change everything. And I have thought, as I walked toward them, about the hours that preceded what just happened on my table. The evening routine, the habit, the small thing that felt harmless because it had always felt harmless. The habits that brought people to me were not dramatic. They were ordinary. They were the things that filled the quiet hour before bed. The late snack, the flat pillow, the news left on, the medication bottle on the nightstand with no thought given to the timing on the label. These were not failures of discipline. They were failures of information. Nobody told these people what I am telling you right now. The system moved them from appointment to prescription to discharge without finding the 30 minutes to explain what nighttime actually does to a cardiovascular system that has been working without rest for 6 or 7 decades. Your heart has been working for you every single minute of every day since before you were born. It has never stopped. It has never asked for recognition. It has compensated for every excess and absorbed every deficiency and kept the rhythm through everything life has placed in front of you. What it needs from you now is not more medication. It needs fewer disruptions during the hours when it is trying to maintain itself. A woman named Dolores came to me 3 years ago, 64 years old, referred after a non-critical cardiac event that had shaken her significantly. She was committed and she was meticulous about implementing every change. When I saw her at her follow-up 8 months later, her overnight blood pressure monitoring showed a completely normalized dipping pattern. She had reduced from 4 medications to 2. Her cardiologist, not me, her primary cardiologist, used the word remarkable. What she said to me that day has stayed with me. She said, "Why didn't someone tell me this 30 years ago?" That question has stayed with me. I don't have a good answer for it. I can only do what I am doing right now. Let us go through what you have learned today. 5 habits that happen before bed and that directly increase cardiac risk in seniors over 60. First, eating within 2 hours of sleep triggers digestive blood redistribution and nocturnal blood pressure reversal. Stop eating 2 hours before bed. And if hunger is real, 1 tablespoon of almond butter is your specific exception. Second, sleeping completely flat allows nocturnal fluid redistribution that increases workload on the sleeping heart. Elevate the head of your bed 4 to 6 inches using risers under the bed frame, not extra pillows. Third, emotionally activating content in the 45 minutes before sleep triggers a cortisol and adrenaline cascade that persists into your sleep window. Replace the last 45 minutes with slow, low-stakes visual content to decelerate your nervous system. Fourth, taking common medications without considering timing creates nighttime interactions with your natural blood pressure patterns. Have a specific conversation with your doctor or pharmacist about the optimal time for each of your current medications. Fifth, dismissing evening warning signals as minor or unrelated means missing the early communication of cardiovascular stress. Keep a written record of how you feel in the hour before sleep for 2 consecutive weeks and bring the physical notebook to your next appointment. Which of these 5 surprises you the most? Tell me in the comments. And if there is someone in your life, a spouse, a sibling, a friend, who is over 60 and doing any of these things tonight without knowing what they are doing to their heart, please share this video with them. Not a screenshot, the full video, because the full picture is what creates the full understanding. If this is the first time you have found this channel, subscribe. We publish every week, and every week, this is what we do. Take the conversation that the 15-minute appointment does not have time for and give it the time it deserves. Before I go, I want to be clear with you in the way that matters to me as a physician and as someone who has spent 31 years seeing what happens when people do not have access to complete information. Everything in this video reflects current cardiovascular research and my clinical experience. It is not a replacement for your relationship with your personal physician. Your body is specific. Your history is specific. Your medications and your conditions and your particular cardiovascular picture are yours alone. Use this video to have better conversations with your doctor. Use it to ask sharper questions. Use it to walk into your next appointment with a notebook and a list and the confidence that your health deserves that level of attention. Because it does. You deserve that level of attention. It is never too late.